I see we're all coming to order. Welcome everybody to this workshop of the Roundtable on Population Health Improvement. I'm Dr. George Isham. I'm co-chair of the Roundtable with Dr. David Kindig. We would both like to welcome you to today's workshop. We want to let everybody know, as I just have in my informal sort of trying to call you together kind of way, want to let everybody know that this meeting is being recorded as well as webcast. I'd also like to welcome all those people that are joining by web. The Roundtable on Population Health Improvement provides a trusted venue for leaders from the public and private sectors to meet and discuss leverage points and opportunities arising from the changes in the social and political environment for achieving population health. We have a vision, this roundtable has a vision of a strong, healthful, productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require a robust national and community-based actions and dependable resources to achieve it. We have the intention to catalyze urgently needed action toward a stronger, more healthful and productive society. And we want to facilitate sustainable, collaborative action by a community of science-informed leaders in public health, healthcare, business, education, early childhood development, housing, agriculture, transportation, economic development, and nonprofit and faith-based organizations. As we've thought about how to accomplish those lofty goals and broad purpose, we've identified sort of 6 areas of activity that we are working on. And we intend over time to, refine our thinking and modify our areas of activity depending upon how things go and how events develop and what new knowledge comes our way. But among those areas that we are currently focusing activity on or thought on are identifying and deploying key population health metrics, ensuring the allocation of adequate resources to achieve improved population health, the topic of today's conversation, identifying, testing, and broadly deploying research, developing and implementing high-impact public and private population health policies, fostering and building relationships that will create action to improve population health, and designing and implementing modern communication to educate about and motivate action directed at improving population health. We had a recent workshop on movements, it occurs to me that our activity is directed at facilitating a movement, creating a social movement toward improved population health. Since we've last met, the Robert Wood Johnson Foundation has released its, the Commission on Healthier Americas released its report, and they've released a new direction and intent to create a culture of health in the country. And it seems to me that, in my personal opinion, and we'll have the opportunity to discuss this further, that sort of activity and intent by that major group resonates with some of the things that we've been thinking here at the Roundtable. And so it's exciting to have yet another conversation in the series on resources that help push toward our vision and mission as a Roundtable, but also facilitates the larger development of the thinking around improving health and affecting its determinants that at least this particular individual member of the Roundtable perceives as becoming a larger and larger conversation, a more frequent conversation across at least many of the places that I travel these days, which is encouraging. So Turning to thinking about this particular workshop, one of our major activities, sponsor workshops for members, stakeholders, and the public to discuss the issues of importance to improving the nation's health, of which this is one. As you know, today's workshop will feature presentations and panel discussions on resources for population health improvement. Resources refers to many different kinds of essential ingredients needed to support the improvement of population health. Resources could be financial, they could be human, workforce and associated educational training needs, or informational, referring to data, technology, networks, and so forth. And could also refer to the broad category of assets that communities bring to the table, from social capital to cultural diversity. And so what we hope to probe over the course of the day is into that topic and better understand those issues and hopefully identify some areas of activity which this group can facilitate progress toward achieving. So we're going to be focusing on financial resources today, that aspect of resources. I've just laid out a broader table, but we are going to actually narrow in on one aspect of that. But roundtables are dynamic, ongoing activities, and so this isn't the last word on resources, and we have a lot of opportunity to come back to the topic and explore its other aspects and facets and understand it better. So for those of you who think that we are unnecessarily going to focus today, we have many other chances to come back over time and further flesh out this dynamic activity that we call a roundtable unfolds. I'd like to introduce Terry Allen, who's a member of the roundtable and who has, I think, provided us a really valuable leadership service by chairing the planning committee for this workshop. He's going to provide an overview of the agenda and a brief context for our topic. He's the Health Commissioner of Cuyahoga County, Ohio, and currently President of the National Association of County and City Health Officials. So I'd like to welcome Terry to the microphone. Terry?